Hi, everybody. I am over the moon excited about today's interview with guest Dr. James L. Wilson. And Dr. Wilson has been a mentor of mine. He's like a father figure to me, and I'm just so excited because he actually is the foremost expert on stress and adrenal fatigue. He is the author of Adrenal Fatigue, the 21st Century Syndrome, which is a super important book for people to understand about the impact that stress has on their body. And so thank you, Doc, for being here. And why don't you just get started with telling us a little bit about yourself?
Well, thank you, Ericka. And thank you very much for inviting me to do this. It's a pleasure to be here with you. And Ericka is a person who knows a tremendous amount about adrenal fatigue herself because of all of her experience that she's had helping numerous people recover from adrenal fatigue. So thank you, Ericka, for the work that you're doing.
Thank you.
The concept started when I was practicing in a small town in rural Ontario, Canada, a place called Fergus, Ontario, a village of about 6,000. And I noticed that there were too many people coming in that had symptoms that I hadn't been taught to treat. And one came especially in this one woman who had just given birth to her third child. And she had checked herself out of the hospital. Her husband checked her out of the hospital. After 2 weeks, she was depressed, and he brought her directly from the hospital into my office. And she said, I know this sounds awful, but I don't want to live. I don't love my children. I don't love my husband. I just don't want to live. Luckily, I had been a psychologist at university before I was a doctor. And so I made I made an agreement with her, bargain with her, that she wouldn't kill herself until next Tuesday, her next appointment. So she made that agreement. And in the meantime, I called everybody I knew. I said, I got this woman who's suicidal, and I don't know what to do about her. And so one doctor suggested that I give her hypothalamus, and another said adrenal. And I decided, sure, I'm going to do both. So when she came in on the next Tuesday, I gave her the hypothalamus and the pituitary, or the adrenals, cortex, and I made her a pact: don't kill yourself until next Tuesday. So she said she would be willing to do that, and I told her the regimen. And I just made up how many she was supposed to take because I didn't know, they didn't know. So next week she came in, she says, I feel the same. I don't feel any different. And I said, it takes a while for these to work. So don't give up. I've already given up. Don't give up until next week. So would you promise not to kill yourself? Look, you can always kill yourself, but you can't unkill yourself. And she says, okay. So came back the next week, still the same. I don't feel it. Don't kill yourself until next week. You've said that 2 weeks in a row, and each day I want to kill myself. If you just wait until next week, I know something's going to happen here soon. Why should I believe you? Well, because if you kill yourself, then you won't get a chance to see if you recover. And your husband will miss you, your kids will miss you. So I pulled out any stops I could think of to get her to do it. And she finally agreed, okay, 1 more week, but this was probably it. And she walked in that next week, and she had just a flicker of a smile. So, yes. And she said, I don't love my husband and I don't love my new babies, but I don't want to kill myself anymore. Said, yes. Yeah. So then in the meantime, I started thinking about what else I could do and reading what else I could do. And I started having her take some multi-B vitamins and vitamin C's. And that seemed to speed up the process a little bit. Mm-hmm. So in a month, she was feeling quite a bit better. She didn't have any feelings for her husband. She was starting to love her baby again. And so over a period of about 3 months, she fully recovered, and that was good. And then, as often happens, I find with physicians, once you become interested in something, you start attracting those kind of patients to you.
Mm-hmm.
So I seemed to get an inordinate number of people that were tired in a special way. They seemed to be tired early in the morning. They seemed to have difficulty sleeping. If they wake up after 8 hours of sleep, they still feel like they wanted to sleep. They didn't feel fully awake. They felt like they had to need coffee or cola to get going again. I had one farmer that I asked him if he drank coffee before he started his rounds, and he says yes. And I says, "How much do you drink?" And he says, 2.5. I says, 2.5 cups? He goes, "No, 2.5 pots."
Oh my goodness.
He had to drink 20 cups of coffee before he could get away from the farm kitchen table to start his chores. And I had all kinds of patients, and I'm desperately trying to help them.
Mm-hmm.
And as I did different examinations with them and trying to figure out what I could do, it somehow occurred to me that it was the adrenals. My mentor, Leo Roy, suggested that, as so did another mentor of mine. And so I thought, well, let's try doing the adrenals. And I know the adrenals need a lot of vitamin C, so let's try that. And so over time, my practice, I was quite young in my practice then. First few weeks I was practicing. And so by the time I got to about a year or so, I started having a waiting list for patients. And then it became imperative for me to help as many people as I could, as fast as I could, because my waiting list would start to grow. And if I couldn't help them on the first or second visit, then they had to wait 2 or 3 weeks to see me the next time to not do anything to help them during that time. So I was pushing myself to try to do what I could to help these people. And then they started coming from further and further away, and things just grew. And I still didn't feel like I knew what I was doing. But I was having these people that were sicker and sicker, and they seemed to be recovering. So whatever I was doing was somehow working. It was some sort of mystery to me. And I'd stay up late, 2 or 3 in the morning, trying to figure out what was wrong with these people and how to better help them. And so over time, it ended up that I developed this more or less this construct of what was wrong with them and what we might be able to do it. And the problem is I had people taking 24 to 27 different supplements. So finally, I thought it was best, maybe I could design a supplement that might help the majority of these people. And we wouldn't have to do these really complicated charts. So I designed a product that, first of all, was called the Adrenal Exhaustion formula. And I soon saw that not everybody that came to me really had damaged adrenals, but they were suffering from stress. So I split those into the Adrenal Rebuilder, which is a non-hormone glandular extract of hypothalamus, pituitary, and adrenal supplements. And they were made from porcine because pork is much closer to humans than bovine, than beef is. So I had them made from porcine and made sure that they didn't have hormones in them, because I didn't want hormones, because I used to work in a stockyard and I saw how those animals were treated. And I saw that if the first animal that was up the chute to get killed, well, they were okay. But by the time you got to the 4th or 5th hundred, they were going nuts. There was nothing normal about their hormone secretion at all. And I could just see, if we didn't get the product without hormones, then we might get a lot in one batch and only a little bit in the next tablet and maybe some in the next one, and you just didn't know. So I wanted to make sure mine didn't have hormones. If I'm going to prescribe them, they don't know how much hormone to give, but I want to make sure that we're giving something that's the building blocks. That's what I'm after. And the reason I'm getting the Adrenal Rebuilder at this time is to repair damaged tissue, whether it's in the adrenal, the hypothalamus, pituitary. So started using that, and then I took those B vitamins and separated them out. And it's not just B vitamins, but it's minerals along with it. And I realized that if we sustained released them, then that allowed that person to feel better longer. So we put them on about a 3.5-hour release so they could take one tablet, a caplet, and then about the time they're ready to take their next one, that was starting to wear down so they could be supported all day and all night long. So that was neat. So I did that with what's called super adrenal stress formula. So that particular one has all the nutrients needed for the adrenals to function. See, one, we got structural damage, and we're repairing that with the Adrenal Rebuilder. But the next, we got to have all the nutrients for this gland called the adrenal gland, about the size of a grape, weighs about 5 to 9 grams, sits over the kidneys, and it secretes about 50 hormones. And these are steroid hormones.
Mm-hmm.
These are all the sex hormones, all the hormones that are driving your body to stay normal. And there's over 50 of them the adrenals are making, and you've got to make it, because if the adrenals aren't making enough of them, you don't feel very good. As a matter of fact, you're like that woman, you're pretty well toasted.
Mm-hmm.
And so it carries with it a lot of other signs and symptoms. And so as I started using the supraadrenal stress formula, I saw it work faster than Adrenal Rebuilder. Adrenal Rebuilder took a month to 2 months to start working. The supraadrenal stress formula started working within about 3 to 4 weeks.
Mm-hmm.
And then I said, I know the adrenals need a lot of vitamin C, but does the world really need another vitamin C? And about 2 years, I had this debate with myself. And I finally looked at the vitamin C's on the market, and I said, yes, it does.
Mm-hmm.
It needs a sustained release vitamin C. It needs to be pH balanced, because under stress, the body becomes acidic. And if I feed them just ascorbic acid, which is another name for vitamin C, then they're going to become acidic, and the body is going to use the reserve of magnesium and calcium it has to neutralize that acidity. And people are already deficient in magnesium and calcium when they're stressed anyway. So I got a pH balance at, but instead of using the magnesium and calcium, I used some magnesium. And then I also used the other minerals that are needed to make the cascade go. And that's the zinc and manganese and copper and zinc, manganese, copper, magnesium. And when we put those four together in a sustained release and it wasn't just the B vitamins, it was the ratio, it was the form, it was the sustained release part that made it work, so that instead of people feeling jazzed like a lot of times they feel with B vitamins, they just feel balanced and supported, and they feel steady. And that's exactly what I was looking for. Well, then we needed a fourth one. The fourth one we needed was to balance what's called the HPA axis. And that stands for the hypothalamus pituitary adrenal axis. That's also known as the stress axis. So we're going to balance the stress axis while we're going to supply the adrenals with the nutrients it needs, which are also the same nutrients the cells need in all kinds of stress too, and also the brain needs these nutrients too. So we're really helping a lot more than just adrenals with supraadrenal stress formula. We're going to use C because as the adrenals are making their different hormones, it's also creating free radicals inside the adrenal gland. And we need a lot of vitamin C to get in there and sustain and release it. Now, another reason we want the sustained release in the vitamin C is that if we just have someone take a glob of vitamin C, nature, our kidneys have learned that if it has a whole bunch of something coming in, it's probably poison, so you better get rid of it as fast as you can. If they come in and we see that the vitamin C is being slowly released over about 3.5 hours, then we see that the titers in the cells go up. In other words, you can measure it in the serum, and you can also measure it in the cell. If you measure it in the serum, you see it go up quickly and down quickly with a regular vitamin C. But if you measure it with our vitamin C, you see it rises in the serum, and then it rises inside the cell, which means it can repair the pro-oxidation that's happening inside the cells as the adrenals make their hormones, and other cells make their other hormones and do the other things. Because vitamin C is the ubiquitous antioxidant in the body. So then we have something to counteract the free radicals being created. We have something to give the supply of the nutrients to make the hormones. We have something to repair the damage of the adrenals and the hypothalamus pituitary if it's present. And then we also have something to balance the HPA axis so they stay in harmony with each other. We have lifestyle. And that's why I wrote the book. Because they're dietary supplements. They supplement what you should be doing with the rest of your life. And that's the food you're eating, it's the exercise you're doing, it's your life.
Right.
So the rest of most of the book is written to how to help yourself get over and recover from adrenal fatigue. So it's been a long journey. When I first saw that woman was in 1978, and it took me about 24 years to formulate the products. And then I got those, and then it took about 2.5 years to write the book.
Mm-hmm.
But the payoff is now we can help so many people now
Yeah.
that have stress and as stress-related illnesses, and including adrenal fatigue. And so that helps. How does it help? Well, any chronic illness is going to be a stressful situation on your body.
Mm-hmm.
They're probably going to need adrenal support.
Mm-hmm.
Anyone that's going through not getting enough sleep, not eating enough, say single mothers, policemen, social workers, people doing shift work, a lot of people with a boss above them, a boss below them, and putting pressure on from both sides. There are just so many different situations.
Yeah. Women
People
in
are trying.
general.
Yeah, they're. We have a lot of people quietly suffering.
Right.
And they sometimes go to the doctor and they tell them how they're feeling. The doctor says, yeah, well, here's some antidepressants. Here's something to help you sleep at night.
Mm-hmm.
Here's some, I don't know, go see a psychiatrist here. Some
Yeah.
of the things I've heard is, well, you're getting older. You're a woman. What do you
Yeah.
expect?
That happened exactly to me.
Really?
That was the exact response from my doctor, when I went in, and I knew that something was off, and thankfully, working with you and being trained by you, I had that experience of knowing this isn't normal for me, and all of a sudden, having just that sudden fatigue onset, weight gain came back, felt like I was just kind of going through a fog all day. And that was exactly the response. And I said, I know there's something going on. And I was supporting my adrenals. And, I needed someone to dive in a little bit deeper. And that's what she said. Well, you're 38 and you have a pretty busy lifestyle and you're getting older. Your metabolism is going to slow down. And this is pretty normal. And I think, a lot of the women, Dr. Wilson, that come to me, they are frustrated because they've heard the very same thing themselves.
So when you hear those words, let me help be an interpreter for you, doctor. When you hear those words, just put equals, I don't know.
Yeah.
Yeah. So when you say, here's a script for a muscle relaxant, here's a script for an anti-anxiety, here's a script for help sleep together, here's an antidepressant. Well, you're getting older, what do you expect? All those equal, I don't know. Right. So, I'm through with this guy. Let me find someone that can really help me. Mm-hmm. And so the nice thing though, Ericka, the nice thing is about 80% of the people who just order the products and read the book recover on their own after time. And as long as they're willing to do the lifestyle changes and the dietary changes in the book. So let's go through some of the common symptoms that some of your listeners may want to know about what is adrenal fatigue.
Yeah.
We talked about the tiredness in the morning, needing coffee or cola to really get going. A lot of times there's a morning low, 9:30 or 10 o'clock, about 2.5 hours after they get up, and they want to hit another cup of coffee, maybe a donut or something. And then they really don't feel fully awake until they have their noon meal. Then around between 2 and 4, 3 and 5, 5 and 6, somewhere in the mid-afternoon, they go through a low. And the low can be as innocuous as just wanting to sit and not do anything for 15 to 20 minutes, to as marked as needing to lay down for 45 minutes to an hour and a half. And then it's kind of funny. It's like around 6 o'clock, a magic key gets turned and they start feeling better than they felt all day. And that magic key, the good energy, lasts till about 9:30 or 10. And they know, even though they're tired, if they push through to about 11, they're going to get a second wind. And then that second wind is going to carry them through to 1:30 or 2, where they can clean, they can write, they can watch TV, where they can do whatever they want to do. And then another kind of key, so this is the adrenal fatigue pattern. There's all kinds of fatigue. There's fatigue from not eating, fatigue from low thyroid, fatigue from congested intestines, from allergies, from all kinds of reasons.
Mm-hmm.
But there's no other fatigue pattern that has this tired, hard to wake up in the morning, needing cola and beverages with caffeine to start the day. Then oftentimes a mid-morning low, followed by a mid-afternoon low, then feeling better at 6 o'clock, then feeling sleepy around 9:30 or 10, but if they push through, they get the second win till 1:30 or 2. And then the kicker is, if they're allowed to sleep about an hour and a half to 2 hours after they usually would get up, they often feel so much more refreshed than if they get up at the usual time. That is the adrenal fatigue pattern.
Mm-hmm.
And there's no other fatigue pattern that matches it.
Mm-hmm.
That's the key. If they're having these, then they need to immediately go to the website, adrenalfatigue.org, take this, the self-grading questionnaire that has the full questionnaire,
Mm-hmm.
and it's self-grading, so they'll know immediately if
Mm-hmm.
they have mild, moderate, or severe adrenal fatigue. And then the nice thing is, the protocol is laid out for them because they take the same 4 supplements. They just take different quantities in order to feel better.
Okay.
And
depending on how severe they are.
that's right. And these are not magic bullets. They're not speed. So you don't take it and 20 minutes you feel better. If you want to do that, go get some speed from your doctor.
Don't do that, people.
No.
Don't do that.
Because it takes time for these nutrients to
Yeah.
work deeply into your body. It's got to be a while for it to do the repair and the stimulation and the support before you start feeling it.
Mm-hmm.
And so it's typically 3 to 4 weeks. Sometimes it's up to 6 weeks.
Right. Yeah. That's one of the most common questions, that once people start working with me, because they've been in this state for so long, they want to know how long until I recover. And my response is, it depends on how severe you are. How long did it take you to get into this place? Basically a matter of small decisions that have built up throughout time to get you to the place. And that's what I've seen adrenal fatigue do in working with practitioners and working with my clients, is that lifestyle decisions built up over time lead people to burnout.
Absolutely true. So how long does it take? My most extreme example was a woman who was 74. And she said from her recollection, she'd had adrenal fatigue all of her life. We did, she thought she was allergic to something. So we did a comprehensive allergic 327 substances. And we found that she was allergic to red juniper. And she had a very mild candida infection. So the candida infection was easy to take care of. And I don't think there was a red juniper within 50 miles of her. And so she started taking supplements and took them for 30 days. And we talked. She said, I don't feel any better. Took them for another 30 days. She talked. She didn't feel any better. She said, I want to quit. I said, tell you what, you take them for another 30 days. Mm-hmm. And if you don't feel better by the time you finish your third set of bottles, then return them and I'll give you your money back for the third set of bottles, because she wanted to quit. Mm-hmm. Well, at the end of the 90 days, she said, I'm feeling better. So we talked in another 30 days and she says, I'm feeling so much better that I've written old acquaintances of mine and said, look, I'm not that B word that you're used to. I'm really a nice person. I suffer from adrenal fatigue all my life and didn't know it. And now I'm a really nice person and we should get together because you'd like me now. And so 74 years old, and she'd had it all of her life. It took her almost 90 days. That's by far the longest I've seen it took. Usual 3 to 4 weeks. I never say 3 to 4 weeks. I always say 6 to 8 weeks, mm-hmm. because if you're a day late, they go, well, see, it's a day old, 3 weeks, I don't feel any better. But if you say it's 6 to 8 weeks, they go, oh, I'm feeling better. It's only 3 weeks. So you're allowed.
Yeah, and I will say a lot of my clients will report back to me after a couple of weeks. Some it's actually sooner than that, but they will say within about 2 weeks that the energy is probably the most improved thing, and mental clarity, that's the first thing.
That's good. And what they don't want to forget is this doesn't mean they're healed. This means they're supported. And
Yes.
you
Yeah.
need to keep this up. Mild for about 6 months, moderate for 9 months to a year,
Mm-hmm.
and severe a year to 2 years.
Mm-hmm.
And then after they've, say, gone 6 months, they can gradually decrease. And interesting thing about the adrenals, there's about a 3-week lag with them. And so if you gradually step them down and you notice that you start to not feel quite so good, if you go to your dosage you were taking 3 weeks ago, that's probably the optimal dosage for you.
Mm-hmm.
And so if you just keep doing that and then say, okay, I still need some, and then at a year you start tapering it down, you go,
Mm-hmm.
yeah, I feel right.
Yeah.
Then you taper it down a little bit more. I still feel okay. Then you maybe go down, well, I still need a little bit. So another 3 months goes by, you do the same thing. Pretty soon you go, I don't feel any different if I take it or don't take it. So that means I don't need it anymore. See, it's not designed for life. It's designed to get you well. And then after that, you don't need it anymore.
Right.
Now, you get in a car wreck or a divorce or something, you may need them again.
Mm-hmm.
But for the current state, and hopefully you made some lifestyle changes, you made some dietary changes we talk about in the book, you're doing some of the meditations talk about in the book to get your life and your energy centered so that you are recreating yourself in a much more healthy way.
Mm-hmm.
So you don't need these supplements to help support you with a lousy lifestyle. So it all combines together. There's no free ride. You have to work on yourself, and you have to work on your attitudes and beliefs and other things like this. But with these supplements, it's so much easier because you know, you can see, you can feel
Mm-hmm.
the progress. And then you've got the millions of people that have successfully overcome adrenal fatigue now.
Yeah.
You're not by yourself. You're with a whole growing group of people. So
Yes.
when there's some idiot comes on and says, oh, there's no such thing as adrenal fatigue, then you can
Yeah.
say, well, you can think whatever you want to think, but I've had the personal experience of it.
Right. Yeah. And this works. This is working. And I've heard that from so many people that they've said, that either their practitioners weren't a believer or they themselves might not have been a believer, but they know that there's definitely a difference from the way that they felt before to how they currently feel. Now, Doc, I wanted to ask you, I guess the normal response when people feel very fatigued and they're burnt out and they have zero energy, one of the symptoms is weight gain.
Yes.
That they have. And a lot of times I will have a consult with someone, with a woman, and she thinks that maybe the answer is going on, a very calorie restrictive diet, something like keto, or, really minimizing calorie intake and over exercise. Can you talk about what the danger is in using excessive exercise and severe calorie restriction if you have high stress levels?
You got a barrel, and the barrel has a little hole in the bottom of it, and then it's open at the top. And that barrel at the bottom has the hole in the bottom.
Mm-hmm.
Has a variable hole. It can be smaller or larger. That barrel is your body, and that water in the barrel are the reserve nutrients. And the restricted calories means there's not a lot of water going into the barrel. And the overexercise is the hole down the bottom of the barrel is getting bigger and bigger. What's going to happen? Are you going to be able to keep that barrel full? There's no way you can keep the barrel full because first of all, you're not putting enough water in. And second, you're letting too much water drain. So eventually you're going to run on empty. Now, what happens just before you hit the bottom? You go through this frenetic energy where you feel like, yeah, man, I can go forever. I don't need to sleep. I only need 3 to 4 hours of sleep. I can go together. Yeah, everything's okay. And then you hit a little thing and you just crash.
Right.
And then you feel like you died and forgot to lay down because you've depleted your nutrients. So you have to be careful about these people. These people need to get the nutrients back into the system slowly, and you need to rejuvenate them slowly. Like these people that have overexhausted, they've overexercised and undernourished themselves. If they go through a collapse, you've got to be careful with them. A lot of times they require IV nutrition. You got to be careful how you bring them back and exercise again. They're very fragile. I want to caution people, please don't get into that. In the last phase of adrenal fatigue, with the adrenal hormones on the outside of the adrenal glands, called the cortex, with them being low, the ones in the very middle, epinephrine, norepinephrine, adrenaline, noradrenaline, those actually spike to protect the body from the last vestiges of exhaustion. And that's what makes that wired, tired feeling, and a feeling like you can't settle down, but you got to do it. You can go forever. I got someone I'm trying to work with now that's in that state, and she's dedicated to her profession, and she says, I know, I just can't do it. And she's getting sick every other week, if not every week. And I know it's a little bit like being an alcoholic. They're addicted to their job, and their stress levels through the roof. I don't know what to do except let her crash. And then when she crashes, then we're going to have to build her up little by little by little. Please don't get into that situation. That makes it so much harder for the doctor, your healthcare practitioner, and it's harder on your body. It takes you longer to regenerate. Sometimes it takes 2-3 years for you to get back again. Please don't get into that. So if you're trying to do a restricted calorie, I've known women that had 800 calorie diets and gained weight.
Right.
And so a lot of times when the thyroid is low and just mildly low, then that'll force people to gain weight. A lot of times their food, if they're stressed when they're eating, that the cortisol rises in two different situations, exercise and eating. So they can actually get a boost in cortisol, and they tend to overeat because they tend to, they're so starved for energy, I better eat a little bit extra. And so the cortisol, excess cortisol with the excess insulin, with the food, a lot of times they choose junk foods, which are mainly refined carbohydrates, that ends up putting on weight. Even though their caloric intake is lower than what it should be, on the times they stuff themselves or the time they take in the refined carbohydrates, that stimulates the cortisol, that stimulates the insulin, and that makes their blood sugar go up, and that gets deposited as fat. And so they don't want to do that. They want to make sure they chew everything 30 to 45 times. You want to make sure they take deep breaths. I recommend that before they do every meal, they stop, close their eyes, look up in the middle of their forehead, and take 10 deep breaths from the stomach in. And why look up here? Because it's a natural stimulation for serotonin. And so when
you're looking in a mirror when you're doing this?
No, I got my eyes closed, and I'm looking right straight in my forehead. So I close my eyes, look up in the center of my forehead, and that causes the optic chiasma to strain, and that causes a release of serotonin from the pineal gland.
Oh, good tip.
And so then if they do that with their breathing, and they do 10 deep breaths from the abdomen in, where they breathe in from the abdomen, breathe out from the abdomen, before they start eating, a lot of times they'll eat about 20% less. If they start with a soup, several studies have shown that if you start with a soup, you'll consume fewer calories. If you chew your food at least 30 times per mouthful, there's about a 15-minute satiety lag between what your brain registers as full and what your stomach registers as full. So if you chew everything at least 30 times a mouthful, then your signals will get to your brain and you'll not eat as much. With my diabetics, I used to have them chew everything 100 times a mouthful. And they started giving me a lot of flack about, we can't chew things 100 times a mouthful. We can't chew things 100 times. So I went home one night and I chewed a teaspoon of brown rice 1,369 times.
Wow.
And I said,
It was like soup when you were done. Yeah.
You chew and chew and chew and chew until it's liquid. And then you swallow it. And that makes it easier to digest both in the stomach and the small intestines. Too, and it makes you consume fewer foods.
Mm-hmm.
Some people need to eat 5 times a day. Other
Mm-hmm.
people once
Mm-hmm.
or twice a day. And you have to listen to your body. So you want to eat about 45 minutes before you actually get hungry, because you're going to consume less food and you're not going to have the energy drops if you do that.
Mm-hmm.
So if you do that, if you exercise and you exercise until you're just mildly out of breath instead of pushing yourself, then you're not going to
Right.
go into the cortisol low after the exercise. So there's a lot of little things you can do. A
Mm-hmm.
lot of them are in the book. A lot of them you're going to counsel your women on that
Mm-hmm.
that are going to help them with their lifestyle. The foods they eat. We're going to cut out the junk foods. Of course, anybody knows they go into a doctor that knows anything, or a healthcare practitioner that knows anything. First thing they're going to say is get rid of your junk food.
Right.
I don't have any junk foods. What do you eat? I usually eat Jello for breakfast. Oh, do you know Jello is 90% sugar? No, Jello doesn't have any sugar. I had that argument with a woman once, and she told me, she swore Jello had no sugar in it. So a lot of times they're not aware
Right.
of the refined carbohydrates. So anything made with sugar and anything made with white flour, that's a junk food.
Mm-hmm.
And
Mm-hmm.
we just had someone in our office who finally heard you shouldn't have refined carbohydrates in your diet. And she had heard me talk about how addictive sugar is.
Mm-hmm.
So she went on the no sugar, no white flour diet.
Mm-hmm.
And she couldn't believe how she had withdrawal symptoms from the sugar and from the white flour. Sugar can
Oh
be
yeah.
very, very addictive.
Well,
And
yeah, and I mean, sugar releases, the same happy hormones, that your brain releases when a happy, when you're in love, and
yeah,
you're kissing your babies. It's the
and,
same thing, and it's addictive.
and those endorphins become a bit habit forming.
Right.
So yeah, so you want to be sure that you stay away from those things, because it's kind of a grease path to hell, and you
Mm-hmm.
don't want that. And what you're trying to do is get healthy. So every time you make a choice, if you go, is this good for me?
Mm-hmm.
Does this bring me a greater level of happiness? Does this help my health? Then most of the time you'll make the best decisions.
Right.
And am I saying you do that all the time? Not every single time, but if you make 90%, 95% of those your
Right.
choices about bringing yourself into health and happiness,
Mm-hmm.
then most of the time you're not going to get it wrong.
Mm-hmm.
You're not going to get it wrong. You're going to make wiser choices. Another thing they can do is they can say, what would Ericka advise me?
That's right. We're gonna get bracelets made.
Yeah.
What would Ericka do?
What would Doc Wilson do? What would they advise me?
Right.
Maybe not what we do. What would
Yeah.
they advise? No,
Right.
I try to live my life.
I do get a little giggly when clients will say that, that they will think about, what would Ericka say in this situation to me? What would she tell me that I should do? You've talked a lot about the importance of nutrition in the role with adrenal fatigue, but can you talk about, because I know you probably know that the keto diet is all of the rage right now, and that's the diet where basically you are completely eliminating your carbohydrate
Yeah, and I
intake,
go further,
and
80% fat.
a lot of fat, some moderate protein, but even the vegetables, because vegetables have carbohydrates, those are the good carbohydrates, but they're limiting them to less than 20 grams per day. Can you talk about the importance of carbohydrates that are not refined in recovering from adrenal fatigue?
This started with a Dr. Stillman back in the 60s, and it's destructive on the body. Your body needs carbohydrates, and they need the unrefined carbohydrates, because that helps the unrefined carbohydrates break down very slowly, and they take about 2.5 hours to digest, whereas the refined sugars are into your bloodstream within 15 minutes.
Mm-hmm.
And that gradual increase is a very satiating part, especially when it's combined with vegetables and some proteins. I like, especially in the person recovering from adrenal fatigue, I like some animal foods, because I've just found they recover much better with animal foods than they did. I tried my best. I was a vegan when I first started seeing that woman, and I realized that I needed animal protein for myself with the energy I was expending, with the kind of stresses I was experiencing. I needed that. I've tried all kinds of ways working with vegans I've tried carnitine and all kinds of other supplements. It just didn't work. So some amount of animal food seems to be necessary for the person with adrenal fatigue to recover, from my experience of 4,000 or 5,000 people.
Mm-hmm.
And so the keto diet, it's a good temporary loss, but it's doing it at a price.
Mm-hmm.
So you're paying a price in order to do this. The same thing with the growth hormone injections. You're paying a price to speed up this metabolism to cause this weight loss. And it's a dangerous situation because one of the biggest things you have to fight there are kidney infections. So and you can also get kidney damage from the way it's being done. So my suggestion is, if you want to lose weight, first of all, get your stress levels down, because stress level by itself can add 20% to your body fat.
Okay, let's just pause right there, because I want to make sure that everyone hears that if weight loss is a goal for you, you have to address stress, because stress can definitely be preventing you from losing weight.
Absolutely. As a matter of fact, it can be adding to you gaining weight.
Yes.
So one of the ways that you can help balance this is 3 times per day, you simply find a quiet place, you close your eyes, you breathe in, look at the back of your eyelids, and just simply say, relax. And you feel yourself relaxing all the way through your body. And you do that for about 10 minutes.
Mm-hmm.
Now, this is beautifully described in a book called Getting Well Again by the Symingtons.
Oh.
It's called Getting Well Again by the Symingtons. They were a husband and wife team. She was a counselor, therapist, a psychologist. He was an oncologist. And they took on the impossible task of trying to help people with terminal cancer try to get well. Mm-hmm. And they did it. And these were people that had failed chemotherapy, radiation, surgery, or a mix of the three. And they did it by simply having the patients visualize their cancer. And they had, believe it or not, they had over a 50% total recovery. If that was a drug, that would be plastered in 144 type over every newspaper in every country. You get a 2% increase in the survival rate of someone with cancer. And it's a great success in the pharmaceutical industry. We're talking about half of the people who were given up for dead, and their immune system's been destroyed by the chemotherapy, surgery, and radiation, and they still lived. Half of them still lived by visualization. So do you think visualization is powerful? Yeah. Absolutely. Yeah. So in this Getting Well Again, look on page 139 to 153, and you'll see that it's not just for people with cancer. It's to help people get healthy again who have any kind of illness. Mm-hmm. And they give a step-by-step process about visualization and how to do it properly. Now, they did some meta-studies with the Symington's techniques. That means there were some publications, some scientific publications about the Symington technique. And then there were some scientists that looked at the publications en masse to see what was going on. And the scientists that reviewed these studies are called meta-scientists. They do meta-studies on the studies. Studies on the studies are called meta-studies. Mm-hmm. And they found that they could predict with 100% accuracy who was going to live and who wasn't going to live by the way they visualized. Mm-hmm. So in the cancer patient, there's a special way of visualizing that's important. But for someone who's simply under stress, if you just follow the rules that they say, the very simple relaxation of closing your eyes, looking at your eyelids, and saying relax, and then feeling your body relax all the way through for about 10 minutes, and then 2 more times in a day, 10 minutes. So for example, I set my watch. I have a little alarm on my watch, and it just says time. And I know that's my time to meditate. Well, I wouldn't call it meditation. That's my time to be still. Mm-hmm. And I simply be still and visualize with as much visualization as I can, while I'm also relaxing. my body relaxing and healing and getting stronger and being more resistant to everything. And I know the days I miss. I really can tell the days I
Yeah.
don't get my
Mhm.
time. So how much did that cost to do 3 times 10 minutes a day? That's not going to break anybody's pocketbook, is it?
No. And, a lot of women that I work with, they will just say, I don't have time to do this. And I think and I say, the impact that 5 or 10 minutes a few times a day will make, the impact that it will make on your life by, spending less than 30 minutes per day to be still, to just be quiet, to think, to pray, whatever you journal, whatever you want to do. The outcome just far outweighs, that small amount of time that you're spending kind of furthering yourself, perpetuating the stress response.
So a lot of companies have looked at this. The automobile industry especially has looked at this, especially back in the 70s and 80s when they were working a lot of overtime. And they found that people working 10 hours a day, 7 days a week, were only 8% more productive than people that work 5 days a week, 8 hours a day. They just got all that overtime they're paying. Remember, these are union guys, so they're getting overtime 40 to 60 hours. After 60 hours, they're getting double and a half. They're getting double overtime, then they're getting double and a half overtime after 60 hours. So it's costing a bunch.
Mm-hmm.
They're only getting 8% more production from not letting their workers rest.
Mm-hmm.
Even if you could drive it down to the mechanics of metal tools, there's a German study that says if you take a wrench and put it on a machine and continually work it, versus another identical wrench that works and then rests and then works and then rests, the one that's on continual movement breaks before the one that has the rest periods. So even in machinery, as inanimate as a metal object, it still breaks. It lasts longer if you give it a rest period.
Yes. Yes.
So how powerful is that?
That's great. I'm glad that you mentioned that study, because that's probably the number one thing that women in particular, they feel guilty for resting or for taking time for themselves, because they just think of all of the other things that they have to be doing. And for whatever reason, I've been the same way. And that's how I led myself to my second burnout, a few years ago, where my hormones were greatly affected because I couldn't say no to anything.
One of the most valuable words you've ever had.
Yeah.
No. Yeah. But absolutely right, Eric. And I'm so sorry you had to experience it. I'm so glad you had the insight to be able to do something about it. And if they say they don't have time or they feel guilty about it, have them replace that with another emotion.
Mm-hmm.
Of happiness for having that 10 minutes, of gratitude for making their body more whole and more healthy. Sometimes they need another emotion to replace that guilt. So there's no reason for it. God, there's is something that's interesting about the Protestant work ethic. It doesn't say it anywhere in the Bible that you need to be a hard worker, that you need to rest. In fact, it says you're supposed to rest on Sunday. But it doesn't tell you need to work 40 hours a week. It doesn't say 60 hours a week. It doesn't say you're a laggard if you let someone work harder than you. It talks about, I'm come that you might have life and you might have it more abundantly.
Mm-hmm.
Well, when you're dragging through life, that's not abundant life, let me tell you. You don't see that glow on their face. You don't have the energy to love. You don't have the energy to give compassion. You need to be fully rested and as stress-free as possible in order for your light to shine to others. It's the least selfish thing you can do.
Yeah. Yeah. This is so great. Wow. We could probably we'll probably have to do a second part interview.
Well, I just said everything I'll ever know. So
that's it. He's done, everybody. But I do have one more question if you have time. Otherwise we can hold it
for you. Yes.
Oh, thanks. So a lot of women are experiencing, or they don't even know that they're experiencing hormone imbalance because of the stress. They might also be going into menopause. How can we balance hormones and treat adrenal fatigue simultaneously?
Well, it's a simultaneous treatment. Remember that in the adrenal glands, two little glands that sit over your kidneys, like we talked about before, are they ever important in menopause and perimenopause?
Mm-hmm.
When I was in practice, I was dealing with a lot of women that had going through perimenopause, menopause. So one of my curiosities was to ask doctors in third world countries what it was like for their women they saw. So I talked to midwives, I talked to naturopathic physicians, I talked to medical doctors who were spending time in the remote areas of the world. And their consistent answer was, it's not really an issue. I mean, few women that have it, there's some herbs they use, and it's not really an issue.
Mm-hmm.
Yeah. And when I stood back and looked at the society and my patients, I'm thinking, does not really an issue make any sense in this? I say, no. I have a woman that came in to me and she said, I've given away my guns to one neighbor. I've given my knives away to another neighbor. I've taken off my belt so I can't hang myself. And I'm just asking that you help get me through the night. And so we arranged for her to be locked up in a police detention center voluntarily for her to keep her from killing herself for that night.
Wow.
I started using progesterone cream with her on her wrist and behind her knees.
Mm-hmm.
And within about 45 minutes, she started feeling better. So she wasn't suicidal by the time she went into the cell. We started putting it on the next morning. Why did I want to do that? Because progesterone is secreted by the adrenal glands with as much as the ovaries producing the progesterone.
Mm-hmm.
40% of estrogen in normally menstruating women is produced by the adrenal cortex. The adrenal cortex, not the ovaries. Ovaries producing 60%, but 40%, the ancillary part, is produced by the adrenal gland. Imagine your car when it only has 60% of the power that it needs.
Mm-hmm.
And progesterone is often lower than estrogen in women circulated. They're also, their DHEA often goes lower. So what are we looking at? We're looking at the adrenals being one of the major reasons why women either feel normal and balanced going through menopause, or women feeling really strung out and having a very difficult time.
Mm-hmm.
And so
that is why you do support not only the hormones, but trying to balance those, but you support the adrenal glands as well, like with the protocol.
Absolutely. And this interesting thing, sometimes I find that women don't have severe adrenal fatigue, but they do better when they take the Rebuilder, even though they're not necessarily damaged to the adrenals. And I found this out. I had to have a relative tell me this, that she had been taking the Adrenal Rebuilder to help herself with menopause, and I didn't know it. And so she said, well, the Adrenal Rebuilder really helps with menopause. I said, you know about that? And she says, yeah, I've been taking it for about 3 months. I really noticed a nice difference. She wasn't taking the other supplements. She was only taking the Rebuilder. So I had her take the rest of the supplements. And of course, it
improves way better.
Dramatic. Yeah, it's pretty dramatic for her. And so I found that the adrenals are extremely important in menopause. And it has to do especially with progesterone, with the progesterone cream dropping. And then the other thing that happens is that during menopause, perimenopause, and menopause, estrogen starts spiking. So you'll go through times the estrogen's low, and then you'll go through an hour or two where estrogen shoots through the roof, and it goes down again. Progesterone helps balance that out. And so if you can get good progesterone production from the adrenal glands, and remember, progesterone is made before estrogen in the adrenal glands. So if you can get the progesterone normalizing in the women, then you're going to have symptoms that are a lot more mild. And in a lot of cases, you need to add a little bit of progesterone cream. Mm-hmm. Oftentimes, the last 2 weeks of the period, like right after they ovulate for the last 2 weeks. For the first month, oftentimes you need to take it the entire month, and then the last 2 weeks. And just about a little dab will do you, about the size of a dime, is about right. If you want an immediate effect, you put it on the wrist, on the behind the knees, on top of the feet, on the forehead and the jugular vein. If you want the more protracted, prolonged effect, you put it on the swimsuit area and you rub it in. It takes about 2 to 3 weeks before the swimsuit area starts absorbing through that fat depot and getting into the bloodstream. Now, you can overuse progesterone, and if you start getting estrogenic symptoms, estrogen-like symptoms where you're crying at movies and you're spotting and things like that, you may be using too much progesterone. And that's why I like the adrenals to do as much as they'll do on their own, because they're going to regulate this. Remember, the adrenals are being regulated by the hypothalamus, that every 3 to 6 seconds is sensing how much of these different hormones you need, and it's sending down the signals to the adrenals. So you got an on-the-spot cameraman that's designing how much should go through you.
Right.
But if you don't have the adequate amount of nutrients, or your body's so depleted that it can't respond to these hormones that are coming down, you're going to feel lousy. So you need to really take care of yourself well during perimenopause and menopause. Exercise is good, but not over-exercising.
Right.
Exercising how they need to do. Breathing is important. The taking the supplements is important, and giving thanks is important. But remember, there's all kinds of other things that you can do. There's acupuncture you can do for perimenopause and menopause. Acupressure sometimes helps. There's a number of different things, but I can tell you the adrenals are core at balancing perimenopause and menopausal women's signs and symptoms and making them balanced overall.
Wow, that's such good information. Thank you so much, Dr. Wilson. I really appreciate all of this. And like I said, we're probably going to have to do a part 2, because I'm sure that we're going to get even more questions after women view this. But thank you again. I appreciate you so much, and we'll talk soon.
Well, Ericka, I appreciate all the work you're doing.